What is up, you guys? Welcome back to the channel. My name's Matt. If you're new here, I make educational mental health videos based on my personal experience as a patient and my various trips into different therapists, medications, all that kind of stuff. So if you're new, click that little subscribe button down below so you don't miss any other videos. And let's get into today's topic, all about therapy. Specifically, what to expect from your first time in a therapy session. So, this question basically comes from a few different friends of mine who I've actually recently gotten into therapy. Rather, convinced them to go into therapy on their own. I did not force them, I did not hold a gun to their head and say, you must go to therapy. This was something that they kind of were thinking about and asked me about. And so I wanted to address some of these kind of concerns and the things that I've been asked and I've read on Reddit and other places, a lot of different places, about different topics involving first time at therapy and kind of what to expect. So let's get started. So the first thing I would say to expect is a lot of questions. And more than that, a lot of talking. The idea of talking to someone new for the first time seems daunting. You're constantly playing in your head, what do I even say? What do I bring up? When is it appropriate to bring up this and this and this? Are they going to judge me? Am I going to look like an idiot? How's this whole thing going to work? Right? A lot of scary questions, a lot of pretty important questions to ask. So let's break through some of these here and see what kind of answers we come up with. Now, again, these are my experiences. This isn't based off of any other research or video or anything like that. This is all me, my experience. I've been in therapy since I was 7 years old, so around 2003-ish, and I've been in and out of therapy ever since, turning 26 in August, so over 15 years of being in and out of therapy, switching therapists. So I've had my fair share of kind of having to do this whole reintroduction and re-meeting someone and re-establishing that bond and kind of picking up where I left off in therapy before. So the first question that seems to come up a bit is, am I going to get diagnosed the second I walk in there? And am I going to get handed a bottle of pills and sent on my way? The answer is no, absolutely not. Especially in terms of diagnosing, that's going to take a long time, several months usually, before you can reach a definitive diagnosis. At the very least, several weeks if you're seeing them once or twice a week. It's going to take a long time to build up any sort of diagnostic impression, the symptoms, what's going on, if there is even something to diagnose in the first place, which there might not be. There are many reasons people go to counseling and therapy. Not all of them have to do with just mental illness or depression and anxiety. Things like work stress, school stress, relationship, family and friend issues, all sorts of things. Moving stress, court stress, you name it. There's a lot of reasons people go to therapy, and it's not just about depression. Another question would be, how often do I have to go? And that would kind of depend on you and what the therapist agree on. If you're meeting, especially in the beginning, there's a lot of information to go over. So you might meet every week for a little while, maybe even twice a week. But again, that's kind of highly individual to you and what you and the therapist or counselor decide on. I would say once a week or once every 2 weeks is probably the two most common times for how frequently someone visits. But that's my experience, and that's what I read a lot of other people saying. But again, that kind of depends on what you two agree on. So there's no definitive answer. Once or twice every week or every other week seems to be the most common answer for that. So I'm sure by now you're wondering, where do we start? What happens this first session, right? Do I have to start launching into every little detail all at once from the very beginning? The answer is no. Your first session, and maybe even part of a second session, is going to be nothing but intake. Intake is basically them compiling information on you. They obviously don't know you, they've never met you. Maybe you were referred from another therapist office, maybe not. Or this is your first time in therapy at all. Either way, they need to do a pretty thorough intake, kind of, I don't want to say investigation, but a kind of getting the history of you and what's going on, and learning about you and why you're there for therapy. I can't talk. So again, it's just getting information about who you are, where you work, where you live. You're by yourself, with family, have siblings. It also includes other medical history, other medical conditions, jail time or prison sentences or anything like that, criminal history if that's a thing. It really covers all bases. It's like a full background check on you. And it's not like a criminal background check, like legality speaking or anything, but just basic information about you that they need to know. Anything that's relevant to treatment, they want to find out from the beginning. Doesn't mean you have to dive into everything at once, but any past traumas, any other past diagnoses, other therapies you've tried, medications you've tried, illicit drugs you've tried, all that kind of stuff, all fair game to come up to be asked on this intake. Usually, intake starts at the first session. Like I said, it can go on to the second session even, if there's a lot to discuss. Usually, therapist sessions are an hour, roughly 55 minutes, an hour. Usually, I would say an intake probably takes an hour and a half. Your first session's usually longer because it builds in all this extra time to get this done, and as well as for not only are they looking at you, but for you to get a sense of them as well. And it gives you time to ask questions or concerns that you have, learn a bit about them as well, and that's always important as well. I know one of the biggest conceptions that people have about therapists or psychologists or any sort of mental health counselor is, are they going to judge me? Or assuming that they will judge you. But that's not the case. That's not what's supposed to happen at all. The therapist's idea, whole idea of a therapist is they're a neutral third-party person. They don't really know you, only by what you tell them and what they learn about you or from family, whoever they talk to, if you sign a release. But either way, they are a neutral third-party person, and the last thing they are there to do is judge you. It's just, that's not part of their job. In fact, it's the exact opposite of their job. They are not there to judge you. They are there to be a third-party, neutral person who can see both sides of an argument, who can help establish healthier thinking patterns and cognitive behavior patterns, can challenge you on beliefs that you have that might not be entirely correct. If you view yourself as a bad person, something like that, they can work with you to kind of pull that out and replace it with better things about yourself. There's a lot of things that they can do, but the last part of their job description would ever be to judge you for anything you say or anything you do in that room. Everything you do, everything you say is completely confidential, and there's only a handful of reasons that they could ever breach that confidentiality once you sign that form. Of course, that's a completely different topic, but there's a few reasons they can break confidentiality. Mostly if you do something illegal and a judge asks to see medical records, or your mental health records rather, with the therapist, progress notes, clinic notes, anything like that. Or if there's just another relevant reason, but there's only a handful of reasons, and they're mostly to do with legal stuff. So I wouldn't worry about that. Everything you say in there is confidential, and they're not ever going to hold that against you. Regardless of all that, no matter why you're going into therapy or why you're thinking about going into therapy, I just have to say I'm incredibly proud of you. It's a huge first step in taking some initiative and recognizing that perhaps there's some patterns, there's some things that are going on with yourself, with your life, how you're responding to things, how you're reacting to things, and how you're behaving, or thinking about yourself that you just want to change, that you're kind of tired of being that way and you want to kind of look into this therapy option. It's a great option. It can make a huge difference and it can really help kind of see things in a different way. Is it going to change you overnight? No, of course not. But if it gives you a different way to look at a perspective of something that's been stressing you out, whether it's work or school, how to talk to somebody or avoid somebody that's giving you issues, how to better deal with mental health symptoms, mental disorders, how to better manage time. There's a million different things that therapy can help with. And there's many different types of therapy that I would never even go into in a video like this. But they're all there on Google if you're curious what they kind of specialize in. CBT, DBT, there's a million kinds of therapies, right? But the point is, they're all useful, and getting this first step in is a huge first step towards self-improvement, which is always a great thing. And I, for one, am super happy that you're pursuing it. So that's it for this video, guys. Hopefully these tips have helped you out, kind of gave you a little bit of my perspective personally of what kind of first time to a therapist was for me. If you have any comments or suggestions for other videos you'd like to see me cover, leave them down below in the comments. If the video helped you out, gave you a different perspective, give it a big thumbs up. And don't forget to hit the subscribe button and hit the little notification bell so you don't miss any of my future videos. I'm always putting out more educational mental health content like this. So I definitely enjoy doing this, and I hope it helps you. Until next time, go talk to your therapist.